Throughout the pandemic, we've been giving you facts, not fear, when it comes to everything COVID. And tonight we're learning more than 300 University of Iowa healthcare employees participated in a study looking at the efficacy of mRNA vaccines in real-world settings. So joining us to talk about that study is Dr. Nicholas Mohr, a professor of emergency medicine at Iowa and one of the lead researchers of this study. Good evening.
Thanks, Stephanie.
Well, first off, what is the purpose of this study?
The purpose of our study was to understand how effective the mRNA vaccines were in real-world application. This was a study of healthcare workers across 33 hospitals around the country in 25 states. And we really wanted to understand how well vaccination for those healthcare workers protected them against contracting COVID-19.
Okay, and were there any real differences between the PFIZER and the Moderna drugs?
One of the analyses that we did for this study was to try to measure the effectiveness of each of those mRNA vaccines. And I think that the take-home message really is that both are very effective at preventing symptomatic infection and certainly severe infection. So
in your data, one was not better than the other?
We measured a little bit of a benefit to the Moderna vaccine, but for both of those vaccines during the period of the study, they prevented infections from healthcare workers who were really working in a high-risk environment. So this is important for us to understand as people are deciding about vaccination even outside hospitals right now. This is an effective vaccine.
I was going to ask you that. This is another piece of information for people who still are on the fence about vaccines and still wondering how effective they are and how safe they are. So what do you hope, especially Iowans, seeing a study like this happening so close to home, what do you think they would get out of this information?
That's a really good question. I think that there have now been a number of different studies to measure the effectiveness and the safety of this vaccine. And this is just another study that I think really reinforces how effective this vaccine is at preventing COVID. As the hospitals in Iowa and around the country continue to treat patients who are infected with that disease and develop severe infections, it's really important that we're protecting ourselves and our community from COVID infection. I think that the vaccine is probably the best way that we have to do that.
And one of the biggest questions we've seen over and over about COVID mitigation, whether it's vaccines or social distancing or mask wearing, is whether or not it would hold up in real world settings. So what does this study help accomplish in that regard?
Even outside the context of a clinical trial, our study showed that vaccines were very effective at preventing COVID, which is probably the most important message that I would have for your viewers tonight. Because as people are deciding whether they should be vaccinated, this is a vaccine that works. It's a vaccine that's been shown in clinical trials and numerous studies like ours to be safe. And employees right here at the University of Iowa were participating in this work that really helps to inform the guidelines really around the country for how we should be viewing vaccination to stop this pandemic.
We do appreciate that work. Dr. Nicholas Mohr, thank you so much for joining us tonight.
Thanks, Stephanie.
And how about you, scared of shots? Well, there may be a solution on the way. Pfizer and other drug companies are now testing an antiviral pill. Around 3,000 people are participating in clinical trials right now. They're living with someone with confirmed symptomatic infection. Patients who receive the drug are given a pill twice a day for 5 or 10 days. Others are given a placebo. The results from the trial could come out by the end of the year.